better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, lights, camera, action, I'm ready to go. I'm never gonna give up, fall down, I just gotta get up, yeah. Yeah, this is my road, lights, camera, action, I'm ready to go.
You're listening to the Tom Ficklin Show on WNHH-LP 103.5 FM, your home for community radio.
Good morning, everybody, and Harry, thanks for that intro, and I just love to hear your voice on Mondays. I'm not sure if I love you as much as your wife loves you, but you know, there can be male love as well. Well, I won't go down that road. It's kind of different type. It gets kind of complicated. I saw Bernard Macklin vibing with the music, and Bernard is here today, and is it Bernard or Peter, by the way? How many names do you have, man?
You know, I'm Bernard Macklin. Peter's just one of my aliases.
Okay, when your alias is
Bernard Macklin.
Okay,
so it's just a Facebook alias.
When I go into the post office and I see the picture most wanted, it says Peter Macklin. That's not you. I see. That's your story, and you're sticking to it. And Sarah Gordon Brilla is with us, and Jamal and Selena and Jackie. I want to be a little informal, but also serious today, because everybody, for the last 7 months enjoying the show, my major point is that I don't want folks to feel that we're just doing this from a normal standpoint. What I'm trying to say is every show, my anxiety is high, just in terms of the global pandemic that we're encountering. And when you watch the news and sometimes watch things, it just seems that people are acting as if everything is okay. Everything is not okay. But on the other hand, a lot of my friends are saying for things to become okay, you want to just work on exercise your hope muscle, exercise your discipline muscle, exercise your spiritual muscle, whatever you can do to realize that, yeah, these are stressful times, but yet there could be some, not necessarily salvation, but there could be some light at the end of the tunnel. And so I want to even contradict myself by saying that today is December 7th. And for all of you history buffs, what happened on December 7th, 1941?
Pearl Harbor.
So today, literally, bombs, December 7th, 1941, bombs dropped in Pearl Harbor. And today, bombs are dropping everywhere in the world. Viral bombs are dropping on all of us, every place in the globe. And so today's show is one of the themes is fight. What is it? Fight the flu, New Haven. What is it, sir?
Fight the flu, New Haven. Yeah, you got it.
Fight the flu, New Haven. And Sarah has been so kind to put up a website that we can go to for information and inspiration in terms of Fight the Flu, New Haven. So, but we're not just fighting the flu here in New Haven. And the CDC has talked about this is supposed to be, and Bernard will share with us about the National Influenza Week. But it's Fight the Flu worldwide. And bombs are dropping on us. You may not be able to see them, but you can see people dropping because of the bombs. You can see people dying because of the bombs. So whether you want to wear a seatbelt, or whether you want to wash your hands, or whether you want to wear a mask or not, realize, folks, that we're in a global. You can be a complicit to murder. Is a point I'm trying to mention. You can be complicit to murder if you don't understand you can save other people's lives. So I'm being somewhat overly dramatic, everybody. Jamal and Jackie and Selena and who else is on the call here? We have Val and Mina.
Valerie.
And Valerie, really appreciate you. So I'm going to ask you guys to just speak a little bit from the heart about why you're involved with this Fight the Flu New Haven campaign and what your specific role might be. But more importantly, why is it important? I mean, we just can't say enough, I don't think, right now, and do enough and be enough about saving ourselves and one another, regardless of your race or your sex or your persuasion, et cetera, et cetera. So that's my soapbox we have another 40 minutes. I'll try to be quiet and give everybody their fair time. Bernard, maybe kick us off a little bit about what's happening this week with the Fight the Flu New Haven National Influenza Week campaign activities, because it's just a small example of how we're urging people to be involved, but also this campaign will last beyond the end of this week.
Oh, for sure, for
Mhm.
sure. We're really just getting started, Tom, and this week is just another piece of what we actually started back in October when I came aboard, and some of the things that happened before I came aboard with Devin and Sarah and the rest of the team with Reach. But I'm just glad to say, well, let me just start off saying my little piece of why I'm here and why it's so important to me. Then I go into the schedule. You know, first of all, Tom, I love myself. And in loving myself, I care about what happens to me, which opens up the door of love, to open up my doors of love, to care about what happens around me, which is other people. I really care about my people, and I want them to get the same advantages, the same anything rewards with that God may give it to all of us. And one of them is health. I want us to have complete health and everyone to be as healthy as possible during this epidemic of COVID, but you know, continuous epidemic of the flu. The flu has been around and we've had a vaccine for over 50 years. And I care about that. I want people to know that we have a proven vaccine with the flu. We're wondering about the vaccine with COVID-19. We will see what happens in the near future. But this week is a National Influenza Week. And us over here at CARE, along with Yale and the New Haven Health Department and all of our partners, we want to launch this week by actually starting with you. You are the smile and start of our week just by being here on your radio show. And we want everybody to know how grateful we are to you and the work that you have done over the 70 some odd years of your life.
Don't put too much out now.
I tell too much of your business, but it is what it is. But it is what it is. But
that is true. 71.
You know what I'm saying? But we just showing you the love because you allowed us to be on your show. That's a great way to kick off this week to your viewers. Secondly, we're coming throughout the week where my team is here on the call. And we're looking to just establish new relationships with some of our barbershops and our hair salons around the area, which is Jackie. Jackie has stepped up to the plate, and that is her area. I'll let her speak to it. We just actually doing surveys and things like that and stepping into different barbershops and beauty shops just to see what they think, because their opinions matter. And this is just information that we need to put out there and let people know why we're so hesitant to deal with different vaccines, not just the flu, but multiple vaccines out there for our own individual reasons. But, you know, this is our way of getting that information and finding out what to do with it. On Wednesday, I have Selena stepping up to the plate over in her home community over in Fairhaven, where we're going to have a clinic. And believe me, it's going to be hot. Trust me, it's going to be hot. People need to come out because we're going to have DJ Herman Ham and his group going to come out and play a little music. So we're going to be getting our swing on a little bit if you can dance. Ain't nothing wrong with dancing. It'll keep you happy.
What time will that be on Wednesday, Bernard?
And that's from 8:30, actually 8:30 to 12 on Wednesday at Grand Avenue and Ferry, right on the corner, right next door to McDonald's. But you'll hear us, you'll hear the music, so you'll know exactly where we are with that big old beautiful 40-foot blue bus that we have with the community healthcare team that will be out there along with Selena handling that piece.
So folks can actually get their flu shots on Wednesday.
Yep, and they can come out and get their flu vaccinations on Wednesday. On Thursday, we're doing something spectacular that I've been waiting to do, and my good friend Valerie is going to step up to the plate and give us a webinar in 3 different medical conditions. One that she's very connected to, one she's very passionate about, and she's just added in a couple of other ones just, you know, to actually inform you. And I'll let her step up to the plate as she began to talk her piece of what she's doing. She'll give you more information on that. And then Friday, thank you. On Friday, we're going to end it with a bang. We're going to bring DJ Herman back out again, and we're going to go over to 98 Ramsdale. And we're going to be in Ramsdale over in the Housing Commission. Over at the Valley Housing Commission, setting it off again in that community, letting them know how much we care about them and giving them flu vaccinations over there as well.
And Bernard, what time on Friday? What time on Friday?
And that's also from 8 a.m. to 12 with Yale Community Health Van, DJ Herman, DJ Herman's group, myself, and the CT Black Nurses Society will be on site with some of the nurses sharing in and offering their assistance with vaccinating that community along with the NAACP. So we look forward to it.
Excellent. And Sarah, thanks so much for putting the flu vaccine schedule up. And that schedule is continually updated. And so we urge people to go to the Fight the Flu New Haven site and see the additional dates that will be transpiring. On Friday, Bernard, you mentioned it's in conjunction with Elm City Communities, but also is the NAACP involved?
The NAACP, through a conversation that we had, they were the ones who actually connected me to the team over in that housing district to get this thing going. So definitely they are involved.
And I mentioned that just before we go to Jackie and then Selena, that this is beyond a collaborative approach. In fact, Sarah, jump in real quick and just share our various partners. Let people know about the various, that this is not just a CARE event or just not a Bernard event, not just a Tom Ficklin event. But on the contrary, we're looking to create and enlist this army across the board.
Absolutely. So some of our partners are the New Haven Health Department, Yale Medicine, Yale School of Medicine, Yale New Haven Hospital. We've been working with the NAACP, like Bernard mentioned. Also, Project Access is a very instrumental partner, Fairhaven Community Health Center, Cornell Scott. Basically, when you think of community and health, like who comes to mind is who we're trying to involve as partners through this work.
11:15. Excellent, in the Fairhaven Health Center, et cetera. Jackie, jump in for a little bit. Jackie Phineas, I'm informal today because I really just want to be personal, but our listeners are not only in the New Haven area, but by virtue of WNHH and by virtue of New Haven Independent and Paul Bass is securing this low power license, we're able to really, as you can well imagine, broadcast throughout the world. And we do have listeners from every place on the planet. So Jackie Phineas has been a committed servant here in New Haven. Jackie, I want to share people, every place that you've worked, but every place that I know that you've worked, you've dealt with people one-on-one directly and in some of the most dire and serious circumstances for them and their families, and still been able to thrive, and also still able to exercise on Saturdays at the Whaley Avenue substation. I know you're recovering from your knee, but share a little bit about the upcoming event that Bernard, or I should say, content and information collection that you're involved with, because it's so important for people to know that their thoughts, their feelings, their emotions are recognized, and we're not ignoring them. Jackie, unmute yourself if you would.
Yeah, thanks, Tom. Unfortunately, haven't been able to get into barbershops and hair salons as I would like to, because they are mandated to only have so many people within the salons or barbershops at a time. However, they are open to me coming and doing surveys, because then I can do one person at a time and I can be in there. So far, people are still a little resistant. A lot of people have become a little more open. I did health surveys at barbershops as a health leader with CARE maybe a year or so ago. And some of the minds have been changed. People are still a little, they're a little more uneducated, I should say, about it. They really just need to understand about the flu shot. They're just kind of, here, oh, it's flu time, get your flu shot, but that's all. No one really talks to them about it and why, and to help them understand so they don't have the fears of getting it. So hopefully you gave me a salon that I'm going to call pretty soon, and hopefully with K's that we'll be able to do something there. But that's kind of like what I'm working with. So I will be going out doing surveys at the barbershops and salons.
Indeed, you could be retired, and Bernard already put me on blast. I could be retired five years ago. But why is this important for you to still be a villager and a servant?
Well, I'm kind of committed to helping people in whichever way that is. Mm-hmm. It doesn't have to be health, but just I just think people need help. I've been working in the human services field for a very long time and in many positions, working with people who are homeless, working with people who have HIV and AIDS. I've done teen parenting. So people need help. And that's kind of why I'm here. I live in New Haven. I'm born in New Haven. I'm committed to New Haven, and I'm committed to the people in New Haven. So I'm in the business because whether it's paid or not, I'm just in the helping people business. And that's what, that's why I'm committed. People need help.
Tremendous. Selena, jump in, share with us. I know I reached out to Selena because she had a few different email addresses, and I love it. So, but you're Yukon affiliated, you're New Haven affiliated, you're very much involved with the Spanish community. But Selena, unmute yourself and share a little bit about some of the events that you've been involved with in terms of coordinating, as well as your passion for why this is important to you.
Hi, thanks for having us on your show, Tom. It's really an honor. So yeah, my name is Selena, and I am working in the Fairhaven community. It's actually, once I'm New Haven born and raised. I'm very proud, and I did go away for college for a little bit, but when I came back home, a lot of my work was with Puerto Rican evacuees from Hurricane Maria, and working with them to either settle in New Haven or figuring out that time in New Haven while they eventually moved back to Puerto Rico in some cases. But for me, I'm a UConn student. I'm getting my MSW in community organizing, and this flu work is very important to me. I actually used to not be a supporter of the flu vaccine, but after listening to a podcast about how it really reduces the amount of hospitalizations for the flu, and also the fact that it can reduce your the severity of your symptoms, and can improve your recovery time after getting the flu shot, that really converted me to being pro flu vaccinations. And it's so important because brown and Black people are already the subject of so many health inequities, that for me, part of serving my community and empowering the community is making sure that we have the information available to make informed decisions about our health, and making sure that we improve access to these resources. So making sure that there's a community health van that can provide flu vaccinations. And what's so great about it is that it's free. There's no health insurance required. And that's some of the major barriers to health for Black and brown folks. So that's part of the reason why this is so important, that making sure that we have the right to take care of our health the same as any community can. And also, what I'm doing, as Bernard mentioned on Wednesday, is the free flu vaccination clinic with the Yale Community Healthcare Van. But I've also been working with Lee Cruz and Dr. Paik from Fairhaven Community Health Center to walk businesses on Grand Avenue, give them some materials about the flu, let them know that the Fairhaven Community Health Care Center is also having free COVID-19 testing as well. And we're just working on building those relationships, making sure that there's materials available for everyone in English and Spanish. And also, thanks to Fairhaven Community Health Center, we've also been giving free masks to 2 masks each, actually. So employees can wear one and then have the other one washed for each employee of each business, so that we can continue to do our part in making sure that we help keep our community safe, because our safety is not just for us, but our safety is about taking care of each other. And I think that's so important, especially in Latinx communities, because we have this strong sense of familyism. And for me, a lot of getting my flu shot really isn't for myself, but to protect my family and my community. And I think, Tom, what you said earlier about being complicit in murder, I don't think that's far from the mark at all. I think that we are all responsible to each other for our health, and part of the way we do that is by getting our vaccinations and wearing our masks, because we all just are entitled to living as healthily as possible.
So, Lena, let me ask you, and I really appreciate that testimony. When you see, in terms of the profession that you're in, the studying that you're doing, the research that you're aware of, and just the personal contacts, when you see someone not wear a mask, when you see someone jeopardize someone else's, what theory goes through your mind? Do you think that person is just evil? Do you think that person is just not concerned with others? Do you think they're just blind? How do you still show the love in your mind? I don't want to put words in your mouth, but when you see the society not reacting to everyone's benefit, what goes through your mind as a health professional?
Well, my first reaction is like very visceral. That's just who I am. But my second reaction is I think it has a lot to do, unfortunately, with like individualism. And a lot of people will say, well, it's my right to not wear a mask. My government shouldn't be able to take away, my right to wear a piece of cloth or not. But my concern then is saying, well, you're also saying that people have the right to die. And that's an issue of necropolitics. And just to kind of make that term more accessible, necropolitics, I first learned about it in anthropology. And it's kind of the best way to define that term is we decide who gets to live or die, whether it be through policies, whether it be through our healthcare, how we make it accessible, how we don't make it accessible. It can even be down to individual choices. I'm going to wear a mask. I'm not going to wear a mask. And it's one thing if that person's risking their own health, but in this case, we're risking other people's health. So when you decide to wear a mask or to not wear a mask, you're really complicit in necropolitics, deciding who has the right to live. And that's very difficult. And I think the way I try to approach it is, okay, I understand you don't want to wear a mask because you feel it infringes on your rights, but what about like other people? Should they have to like get sick, or should they have to suffer because you don't want to wear a mask? It's again, this herd immunity is so important. We are only going to get through this if we all do it together.
And I'm so glad you shared that. And Sarah's going to share with us some of the flu myths and the flu information, but people forget that even just that flu is spread. We know about COVID, but the flu virus is spread. So wearing the mask helps to prevent both of those things from happening. Selena, thank you so much. Val, I know you're at work, excuse me, at work, so I appreciate your being able to take the time. And Jamal, I'm going to come to you and Mina as well. But Val, kind of jump in as well, because there's a project that you're working on in conjunction and collaboration with Bernard that's really important as well in terms of additional community education.
Hi, thanks, Tom, for letting us be on your show today. Appreciate the opportunity. But yes, so my name is Val, and I'm also one of the outreach assistants working with the New Haven Fight the Flu Care Program. And part of what I'm doing is looking at, I am a public health professional. I have been working in the field of public health for about 25 years, working with persons in various infectious diseases, specifically with the HIV infected and affected population. So in looking at now the COVID-19 and in looking in the influenza, there are a lot of parallels with HIV. Specifically, the one that stands out to me is the stigma that's attached to it. Stigma is something, the reason that I got into public health to begin with, because myself being a woman of color, I started off in college as a nursing major and then decided to go into, I realized that I didn't like blood, and I guess you can't not like blood and be a nurse. So I decided that I was going to go into public health. And at the time, I was a young college student just looking to do something where the classes that I took in nursing would kind of transfer over. And then I discovered this thing called public health. And my first assignment as a public health professional was going over to a major factory in New Haven and doing some work with blood pressure screenings. And several men that were there with the blood pressure screenings had blood pressures that the little chart that I was carrying around told me they should be going to the hospital, but they were not able to go to the hospital because the profession that they were in did not give them the time off, and they did not get paid for their time off. So although I was this young professional and my little chart said that they needed to go to the hospital, they were talking about their way to provide for their families, and taking time off just was not a part of what they were able to do. And that's when I really got my first lesson in what public health was and meeting people where they were at. So I started to brainstorm and think outside the box, and what was a way that I could bring this service to these men without having them to have to take off of work. So I spoke to my supervisor, and we were able to bring a provider to their lunchroom and set up an area to do some services for those men to treat their blood pressure on a regular basis, a biweekly basis right there. And that is kind of what started my plight in public health, and understanding that specifically the persons that were having the blood pressure higher, the persons that have the higher incidence of the flu, the persons that have the higher incidence of COVID-19, the persons that have a higher likelihood to have HIV are persons who look like me. And that bothered me. So that set a fire inside of me, that without that education, in order to get services and meet these people where they're at, I believe it was Selena that talked about the access issue, where we do have persons that don't have access to insurances. We do have people that never have had a naturalistic doctor or anything like that. So some services that persons may be available to them, our healthcare system does not allow us to do that. And also in there's a lot of stigma. There's a lot of myths and everything. So we get back to educating, and if it's somebody who looks like them, who is bringing this information, I'm able to build up a situation of trust. So what I'm looking to do with this webinar that I'm putting together is, first of all, look at the parallels that are in HIV, influenza, and COVID-19, because there is a lot of stigma around persons who were HIV positive, to the point that it causes them to have mental health issues and to isolate and not want to come out and give their diagnosis. The same thing is happening to those persons who now have COVID-19. And the same thing is happening around the flu vaccine. Persons in the African American and Hispanic communities are less likely to take a flu vaccine because of the stigma that surrounds it. Everyone is familiar with the Tuskegee experiment, and there's a lot of myths that surround that. And so there's a lot of people that really think that because of that situation that was very real, that happened to persons of color, there's a lot of fear. So if I can try to help to ease some of those fears and encourage people to go and get their flu vaccinations done, that will helpfully bring down the disparities. When I watch the TV and I see persons who look like me constantly passing away of the different viruses that are out there, that lights my fire to be out here and do this work even more. So that's what kind of brought me here. I am going to be doing this webinar at 7 p.m. On Thursday, and I hope that as many people as can join in. I am not an expert on everything. I know a lot of HIV, but I don't want it to be a formal discussion. I would like it to just be an informal conversation where we can kind of break down some of the myths and facts that are out there and just educate the people, and hopefully get some people to get to some of those clinics that are going on in the community.
Excellent, excellent. And Mina and Jamal, before I come to you, just Val, when you're talking about there's a reason that we call it COVID-19, because there will be other infectious diseases, and for better or for worse, we have to really realize that this is just, we have polio, we have penicillin, we have other things that have occurred to us in the past, but there's going to be future pathogens, future kind of viruses that are going to be affecting us. So to take ownership of your health is so important, and to be aware that you got to really take advantage of scientific discoveries and not be blinded about the benefits. Sarah, and Jamal and Mina, just before I come to you, Sarah, because we are on radio as well, kind of just go through a few of those slides and just articulate and sound out, if you will, for folks that are listening on radio.
Absolutely. So, I mean, Val really hit the nail on the head. There is a lot of stigma and a lot of misinformation around the flu vaccine. And this slide actually highlights the fact that in 2018, 41% of Americans said that they don't intend on getting the flu vaccine. Now, that was 2018. It's 2020. Obviously, we have COVID and the political climate is much different. What that number probably is much higher now, is what I would say. So, talking about the racial disparities with the flu and the higher rate of flu cases and hospitalizations, but then you see the lower rates of vaccination, which really are the call to action of why this work is important. And then some of the myths and truths that we discovered. We did some focus groups and listening sessions early on in this project and talked to community members about, what have you heard about the flu vaccine and what are your thoughts about it? And some myths that came up were that the flu shot can give you the flu, that it's not effective, that it's not, the flu itself is not that serious. And we know, the flu vaccine itself cannot give you the flu because it does not contain a live virus. You do get some side effects, which, you don't feel great, but in the long term, it's, a drop in the bucket compared to the actual flu illness. The flu shot, its effectiveness rate is between 40 to 60% in fully preventing the flu. However, Selena touched on this too. It will lower the duration. If you contract the flu and you have a vaccine, it will lower the duration that you're sick for, and it will make it less severe. So something that could typically be a trip to the hospital may mean that you're just, lying in bed for a few days.
Mm-hmm.
And then the flu vaccine, the flu is not that serious, and the flu is very serious. It's a very deadly disease. We heard a lot of conversation about this when COVID first hit. It was like, oh, it's just like the flu. It's just like the flu. Well, the flu is still very serious and people still die from it. So, let's not get that wrong. Another myth is that the flu vaccine isn't safe. The vaccine's been in existence for 50 years. And we, publicly, the vaccine process has really, come to light through the work with the COVID vaccine, and the testing that happens is very rigorous. So imagine, how fine-tuned that testing may be after 50 years. I can protect myself from the flu by eating right and washing my hands regularly. Sure, those things are very important, but the single best way is by getting a flu vaccine. And then the flu vaccination can increase my risk of getting COVID-19. There is no research that points to that. And I think it's important to note that a flu vaccine is a flu vaccine. There is nothing else that is going in there that is going to vaccinate you against anything else.
Excellent, excellent. Mina, how are you doing? Unmute yourself. Join in, and Jamal, I'm saving you for last because you're a gentleman and you're a patient person, and you work for Yale, so you've been around for 400 years, and well, maybe you're not 400 years old, but at any rate, you're affiliated with an organization that's been around for a while, so you're a patient person. You're not going anywhere. Mina, welcome.
Hi, thank you for having me. How are you doing?
Thank you for taking the time.
So, just to give myself a little bit of background, I actually have a background in HIV and working and with reportings and things like that. But what makes me passionate about the flu and making sure that people get vaccinated, first of all, I had the flu. We know many people who has had the flu, and it was a terrible experience for me. And if I would have had the information up hand, I think I would have gotten my flu vaccine when I gotten sick, or even before I've gotten sick. But the thing is, it's just that's what I'm noticing, especially with people, especially in the Black and Brown communities. There's a lot of misinformation. So a lot of my conversation so far has been individuals,
yes.
And just talking to them and just trying to get an understanding as to why do you get the flu vaccine, why you don't get the flu vaccines, and just trying to talk to them and try to dispel some of these myths. Because, I have met people who are older than me and they're like, no, I don't get the flu vaccine because I get sick from it, or I don't get the flu vaccine because it's a government conspiracy or something like that. And I tell them time and time again, you do realize by getting the flu vaccine, you're helping your community, you're helping yourself. And on a level of you're helping your family in making sure that they stay healthy, because there's people every day, especially during the flu season, they're dying every day. And then, with COVID, that's another added mix. So why not give yourself that additional protection?
Indeed. And Mina, so tell us a little bit, did you grow up in New Haven?
No, I actually grew up in the Bronx, New York, and then I finally moved out here with my family when I was 19.
Okay.
So New Haven became my home away from home, so to speak. And I grew to love the people here and everyone that I've met and came across. I mean, New Haven has been great to me.
Excellent, 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 excellent. Jamal, you're not part of Bernard's team, but on the other hand, the purpose of this show is that we're on the same team now. It's a big team that we need, a universal team of health warriors, if I can use that phrase. So Jamal, share with us a little bit about Mr. Thomas, why you decided to take some time this morning to spend with us.
Well, first, I think I love the conversation and everything that I've heard so far. It's a lot that really resonates with me in reflecting on what brings me here. And while I think I may be the only person on this call who's not a health professional by practice, I'm a lawyer. I do a lot of things around social justice. But what brings me to this work is really rooted in what Bernard started this conversation with, and it's about kind of love. It's love for self, which expands and spreads to love of community and love of other communities as well. But I think, thinking about what thinking about that love for the community really engenders a commitment to help when you see challenges and issues. The other thing for me that really brings me to this is these two recognitions. And one is that our communities, and when I'm thinking our communities, it's, the African American community, it's the broader diaspora, it's the Latinx community. We face an ongoing health crisis that is caused by deeper inequities in this country, in this world. And it's something that we see present itself in these different ways, both in terms of the flu, in terms of COVID-19, in terms of higher blood pressure, and just a wide range of health issues that impact our community differently because a lot of the inequities that we face. And while I think there are a lot of ways that there are a lot of keys to help solve those issues, as Val mentioned in her part of the conversation, it's really intertwined with economic and lots of other issues that are very kind of big and kind of scary to get your arms around. But I think an important key to this, and something that's been central to a lot of the work that I've done at least over the last 5 years at Yale, is how much a key to that lies in our communities, both in terms of finding ways to kind of meet people where they are and educate them so that they feel empowered and more at the center of their own healthcare. They don't feel like just patients or subjects, but feel like they are in control and can have the tools to really navigate things. And also just thinking of all these community organizations that are out there and finding ways to kind of uplift the work we're doing. Because I spoke to Bernard a couple of been trying to reach out, trying to connect, and we're busy and these things happen, but we were able to connect. And one of the things that strikes me is that there are always these opportunities for us all to kind of collaborate and connect and kind of uplift each other through these kinds of through these kinds of initiatives. And I know a lot of the work that I do, and a lot of the work I intend to do, is really to highlight as much of that as possible. To use any initiative that I'm doing as an opportunity to connect to other people, to help people access some other great initiative or activity or something like that that's going on. Because one thing that just thinking back to the education piece, when you asked about the masks, there's a I can definitely relate to what I know Selena mentioned as their first emotional reaction, and I would definitely have that. But I think that what strikes me is that there's an absence of education around these things. There's
Mhm.
not a clear sense of, we get inconsistent messages. We don't have a lot of great reasons for why we should be doing things. We don't educate people about, the importance of mitigating risk and how and exact people don't. I think in many cases people don't really have a clear understanding of exactly how this can help themselves, their family, their community. And even when they see a message from one one person who's an authority figure, that can be, contradicted by someplace else.
Mhm.
And you know and just to speak for a moment about, some of the work we're doing at the moment, one of the
Sure.
initiatives the initiative we're working on now at Yale, and it's in partnership with, well, I'll talk about partnerships in a second, but the notion of it is that if we if people are getting real information about this crisis that's actually helpful, that's in terms and in language that they can understand, and it's from people who they know and who they trust, and trust for good reason because they're people who are pillars of their communities, then we can really make some difference in people's behavior, and then people will feel like they have some control of things in this moment that is very scary, but can can be one where we can really manage the risk in a meaningful way. You know, so we have this project, and it's something we're doing in. It's the brainchild of Darcy Cobbs Lomax, who's in
Mhm.
part of Yale New Haven Health, and we're partnering with her in the hospital, as well as the fraternity Phi Delta Sigma, with some
Mhm.
of the employee affinity groups at Yale, such as like YAA for African American employees. There's YLNG for Latino employees, and as well as the Cancer Action Prevention and Engagement at Yale, which is a partnership with Smilo and the hospital, as well as New Haven Healthy Start. And so the idea is to bring a lot of people under one umbrella to get this information and get some materials that could be helpful to people, such as masks, such as um, portals for them to access free or low cost health care, and information about both the flu and COVID, both of which are going to be really challenging to deal with over the winter. And getting in the idea of this partnership is getting this information out to people. And the most important part of this partnership are, I mentioned those pillars of the community. What I'm talking about are our barbers. It's the barbers, it's the salons. And one of the amazing things about New Haven is that we have so many of these shops that are run by really entrepreneurs who really think a lot about the community, and who care, and who want to do what they can to help. And
Right.
so the idea would be, I know that it was mentioned that access to shops is difficult because of safety precautions, which is very true. But we have community health workers who are training shops, the barbers and the salon owners, to then share information with folks so that they can, along with these materials with folks, so that they can get some basic information about what this virus is, how it's transmitted, and just what some common sense best practices there can be around safety. Which these all sound like very simple things, but when you reflect on just the when you think about like the bomb metaphor you were talking about before, there's so many places we get misinformation from people from the very top on down
Mhm.
about what's actually going on and what to do to stop it. This is something, getting some of that basic information out to people, I think could be pretty helpful, along with information about things like, this flu initiative, is which I think is going to be an ongoing need for the winter.
Well,
Um, yeah,
that's great. And we want to thank Melanie from Clifford Beers also for making the initial introduction to one of us.
yes, yes,
Sarah should
absolutely.
amplify in terms of Jamal mentioned some of the messaging. Tease people a little bit about maybe the bike racks. We might not have to mention exactly who will be on the bike racks, but it resonates with what Jamal was mentioning about trusted messengers. as well as information that people can receive. They can just email us how they can get, your fact sheet and et cetera, et cetera.
Absolutely. So the website fighttheflunewhaven.com is where you can go to access some of the myths and truths that we were talking about earlier, as well as a full calendar of the ongoing events that we're hosting. But back to the, trusted messengers, obviously the outreach team in itself is a trusted messenger, but talking about, health communications and seeing that in some sort of a media campaign in a sense. So we've partnered with a lot of faith leaders and residents of the community. And I think just basically these, pillars of the community who people look to when they need information. Well, these are individuals who are speaking out as to why they got their flu vaccine. What was the reason behind it? Did they, in the faith community, is it, to protect parishioners? Is it to, thinking outside of yourself, basically, and what it means to get your flu vaccine? And then, back to Val's point, trying to really push through some of that stigma and highlight like, hey, I got the vaccine, even though it's, controversial in our community, but I got it and this is why, and I'm okay. And I mean, that's something Bernard says all the time. He's like, I am a Black man and I got my flu vaccine and I'm still here. So, I think like those stories, are really instrumental in help debunking the myths and overcoming the mass amount of stigma.
So there are going to be some posters around town. Tease people a little bit there.
So all throughout various locations in New Haven, there are these large panels that are about 6 feet by 4 feet. And we have photographs of community leaders with their reasons as to why they got their flu vaccine. And then you'll see, for a call for more information, going to our website, things like that. We're also working on a street banner, which will hopefully be up in January. And there's just going to be like an ongoing conversation. And, to Jamal's point, like this isn't going to stop when December ends. Like flu season actually goes all the way till May. So not saying that, our efforts are going to be as this intense all the way through, but it's important to continue the conversation, because something that I really find important is it is not our job to sit back and tell people what to do with their bodies, but it is important to arm them with information. And I think that, prevention through education is really important. And it may not convince someone to, get their flu shot this year, but it could put something, in their thought process for next year that, may spark some interest. So. Indeed.
And as you say, even to be a little more receptive to taking the COVID vaccine once it becomes available, because as mentioned, this is going to, even the flu shot, just to remind folks that every year there's a new formulation. Not to get into the scientific technicalities, but just understand that viruses and taking ownership of your health. This isn't a flu. Initially, it was swine flu. We forget that we used to use the word swine flu. That's for COVID. So there's something kicking in about civilizations and our encroachment on the animal kingdom, and perhaps we may be a walking virus as well. About 8 minutes, and so Val, I want to give you a chance for some closing remarks, and Selena as well. Bernard referenced some of the other team members that are, in terms of the community members that people will see around town. They'll see Selena, they'll see Val, they'll see Jackie. Who else is on the team?
They'll see Douglas Kurtz, they'll see Rodolfo Lopez, who wasn't on the call, Arlene Williams, that wasn't on the call today. We have actually 8 of us, 9 including myself, that is out here in different parts of the cities actually doing different things. We all trying to make sure we're trying to touch as many pieces as we absolutely can with 8 people. And I think right at this moment, we're doing a fantastic job of doing that. We're connecting with as many people as we possibly can and getting this information to them. With, as they say, being boots on the ground, that's exactly what we are all over New Haven. But the funny thing I don't want to leave out, yes, we're putting a point on Black and brown people, but to this day, we haven't turned anyone away from being vaccinated. We care about everybody that walks up to the van, everybody that walks up to us assisting, looking for assistance. We care about the people. And that's one thing that I hope that the rest of the world would see. through our efforts is that we care about everybody. Anybody that's seeking help, anybody that wants to be vaccinated, we're going to vaccinate you. But we definitely going to stay key into those high-risk areas that the grant is particular to. But that's who actually you didn't get a chance to hear from today, was those 3 individuals.
And vaccinations for free.
You know, there's no cost. The state has, thank you for the state of Connecticut. They have given us a significant amount of vaccinations that at no cost to the residents of New Haven.
Now, I will say, Bernard, that I had my flu vax shot, and my arm did hurt for like a day and a half.
Oh yeah.
I'm just saying, Jamal and Mina and Selena, my arm did hurt. You know,
well, we know.
My arm did hurt for a day and a half.
We know you're a little sensitive. You're a little different. No, but I will say it is you're gonna feel it. But I'd rather feel that little pinch than to give my life for it.
There you go.
I'm gonna get a little weary and a little lightheaded, to keep my life. Then that's something that I just have to do to experience something for a short time that may save me for a lifetime.
Amen. And Selena, last words, and then Val and Jamal, I want to come back to you as well.
Again, I just want to thank you for having us on the show. Thank you, New Haven, and all the listeners for having us spend some time with you this morning or afternoon or wherever you're at. And I would say in Spanish, hay que luchar contra la flu, New Haven. Hay que luchar contra la gripe, and let's have a happy and safe holiday season and year, and for many more years to come.
Excellent. Val?
Yeah, I would like for just to all of us that are listening in and all of us that are here on the panel, how many of us have a cell phone? And for those of us that have a cell phone, how many of us have our cell phone in a case?
In a case? Oh, no.
In a case. I'm assuming that the majority of us have our cell phone in a case. And there is a lot of myths that's out there about the 5G. There is a lot of myths that are out there that how the cell phone can be very dangerous to you. However, we still have a cell phone, and we even took and put that cell phone in the case. That's a layer of protection that we offer to our phone. Aren't you more important than your cell phone? So if you're going to give your phone that case to protect you, why not protect yourself with that same level of care?
Amen. Jamal.
Just very quick, Tom, thanks so much for having me join. It's been great, and it's been amazing to hear from everyone. And just to echo your point earlier, thanks so much to Melanie and all the staff at Clifford Beers for helping make this connection. On our part, our initiative, we're going to be in 20 barbershops in the greater New Haven area. We have flyers in the window, so keep your eye out for that. And you can come for a haircut, come to get your hair done in a safe way, and you leave with a COVID kit. You leave with some incredibly important information about this pandemic, something to arm yourself with knowledge to help navigate through these really uncertain times.
Sure. And perhaps, Sarah, Jamal might want to share some of that information with you that you could post on the Fight the Flu New Haven site, et cetera, and kind of create the cross-fertilization and the synergy that would be
absolutely.
tremendous.
And add our client to that bag.
Harry, our station manager, is going to play the music in a second, so that'll be our cue. But until he does, we have the forum is ours. Sarah, any last words?
Keep on doing the right thing and fight the flu.
Amen. Fight the flu, and everybody's welcome. And this is a fight for all of us. Thanks, everybody. That's Zach Carlin. The song as we go out is by Zach Carlin. And never give up and succeed.
Thanks, everyone.
Stay healthy, stay well. Thanks again, everyone.
Never gonna give up. Stay safe.
Fall down, I just gotta get up, hey.
This is Harry Drove, and you're listening to WNHHLP 103.5 FM.